Local health officials say they are seeing an explosion of COVID-19 infections in young people. And now researchers are looking into whether kids could face long-term health problems from the virus. NBC4's Angie Crouch joining us live now with a warning from pediatricians. Angie.
That's right. While most kids do well with COVID-19, the CDC does tell us that 45 children in the U.S. have died from the illness, but more than 336 others have become infected. And while most do recover, doctors are warning they could have long-term effects to the health and development of their brains. 15-year-old Nia Houghton spent several weeks in the intensive care unit suffering from seizures and hallucinations after being diagnosed with COVID-19.
I couldn't tell what was real from reality, so it was really scary.
Weeks later, the teen still suffers from fatigue and memory problems, and researchers want to know why. They're investigating long-term complications for children who've contracted COVID-19 and an associated illness called multisystem inflammatory syndrome, or MIS-C, which causes massive swelling throughout the body.
Children that seem to get it the worst or have risk factors including obesity, some underlying conditions such as diabetes.
Dr. Richard Kang heads up the pediatric intensive care unit at Dignity Health Northridge Hospital. He successfully treated 10 children with COVID-19 and 1 with MIS-C. Dr. Kang advises parents to check with their pediatrician as soon as their child shows any unusual symptoms, because in this current environment, it's better to be safe than sorry.
It's that feeling that young people feel they're invincible. That even if they catch the virus, they probably won't get sick, and that's not true.
Studies show children under 10 are just as capable as adults of spreading coronavirus, and doctors warn against even small gatherings with people outside your household.
I think people feel safe as long as they're small numbers, but again, we know that there's a good proportion of people who are asymptomatic carriers, and it just takes one in a party to spread it to 10 people, and then you could see how it can spread exponentially from then on.
Now, further complicating matters as we head into the fall flu season, the CDC's warning that we could see a recurrence of a rare neurological disease called acute flaccid myelitis. This is an inflammatory condition. It can cause weakness in the arms and legs, and it can lead to paralysis. Now, it often shows up after a respiratory disease or illness, and it usually affects children between August and November. It tends to peak every other year. That's why they're worried about it this fall. They're warning parents, please be advised that this could be out there. They want people to be aware of what these symptoms are and check with your pediatrician at the first sign of any problems. Reporting live, Angie Crouch, NBC4 News.
All right, thank you, Angie.